We thought we will record 30-day evaluation for Dr. Wertz. Um, so congratulations, first of all, 30 days here.
Thank you. Thank you
We
for
are
having me.
absolutely. So I want to start by asking you to just tell us a little bit about your previous job.
Okay, so my previous job, I straight after residency joined a private practice. It's a well-established clinic, and basically out of my residency program, there were two well-established clinics that most residents went to, and it was good to start with, honestly. But I think, being a young physician, I kind of just didn't know the way of the world, and sooner or later the business of medicine kind of wore me down, and seeing that kind of quickly became the top priority versus the patient really wore me down, and honestly kind of started to burn me out. And 7 years out of residency, it's pretty sad to start to feel worn down.
Yeah.
And that's when I started to look for a different way, which surprisingly had already been found and worked out by people like Dr. Goyle.
Awesome. So you kind of answered my second question. So what led to the jump of, from your previous job to finding us and coming and working with us? What was your biggest apprehension joining us?
We should probably ask my husband this, because he's the one who listened to all the hemming and hawing. I think it's hard to make changes, and I am a person who kind of both ways. I like change, and I tend to be somebody who kind of jumps off quickly to make changes. We make quick decisions to buy houses, like turn around and all of a sudden buy a house, and all of a sudden make like big choices like that. That's like we just actually made a big decision that I have to talk to you about a little bit.
Okay.
It's not a big deal really, but I need a day off. So like in some ways it's kind of not that surprising, but to think I had an established career, right?
Mm-hmm.
Like I had a career that could take me, and a reasonably comfortable one, especially in comparison to what else is out there. I did have a comfortable spot,
Mm-hmm.
right? I had a slightly lower number of patients per day. I had some flexibility to my schedule. I was close to my daughter's school. Like I had several things going for me there.
Mm-hmm.
And so to think about losing the things that I was comfortable with, and also to move to kind of an alternative practice, right? If this didn't work out, I think that probably was my biggest worry. If this didn't work out,
Mm-hmm.
was it going to affect me getting back into the traditional game, if you will?
Yeah.
I think that probably was my biggest worry.
Yeah, makes sense. So, you've been here a few weeks, and I want you to help us understand your experience here, but as two different ways, right? Like as a physician, your experience here, like how you are able to practice medicine, because that's different. But then also as an employee coming and joining a much smaller organization than you have previously worked at. So how has that experience been? Let's start with the employee first. So how was your experience kind of as an employee?
It's been great. People are nice.
Okay.
Which shouldn't be surprising. Yeah, literally, that just people are nice, and people are open, and people are willing to help, and that just like it's a collegial environment. That my first week here, I don't know if it was my second week, that you wanted me to not only talk about a patient with you, but to go see a patient, right? That just doesn't happen. That it's all, and you say that exactly, that it's like a residency team environment. We all sit in a room together instead of holing up in our own little offices. And even, with the MAs or whoever else, it's like everybody's on the same page. We're all on this little communication app together where we can fire off questions and discuss things. And all very open to ideas of how can we make it better? How can we work together? We're all doing the same thing. We're all here to take care of the patients. We're all here to fix healthcare, as you say, right? We're all doing it together. It takes all of us. And I really like that, because even on the simple day-to-day operation of trying to take care of one single patient, it takes all of us. Like whoever answers the phone call, whoever talks to the patient first, whoever gets the form off of the internet, somebody wants to join, it's everybody. We can't do any single thing for the patient if each one of us isn't here and isn't doing a great job.
Awesome. So, as an employee, when you join a new organization, there is a lot of new things to learn, right? New systems, new softwares, new EMR. How good of a job did we do to kind of, slowly get you, accustomed to all those things? Because again, we are a small organization. We are also learning on how to, onboard our doctors and physicians better. So give us, on a scale of 0 to 10, how did we do?
I think it was great. So the thing that I really liked, and I think it worked out well with, I had those 2 weeks in between of being able to join the Tuesday meetings beforehand, I think was really great. And like for my personality, like even just to see faces and kind of learn some personalities, like it made me feel a little more comfortable too, like coming in and kind of having some familiarity with people. And then like having some idea of how things are going to kind of work. And then Jay setting me up with sprues and with elation and those kind of things. I think that was good because I kind of opened things and played around a little bit. So I had a little bit of idea of how some of it worked, at least a little bit. And I had kind of sent some messages to Jay, for instance, about, I don't know what, but so I think that helped. And then literally T's checklist of things of on elation, open a patient, and like this, that, and the other, which when you look at it, you're like, oh, this is a lot. But really, I mean, you got to do it versus honestly, my experience last time was, hey, you're here, go, right? It's like, go where, right? So, or it's like you wait, which sometimes, I mean, you can't think of everything, right? And that was one thing that she literally thought of was like, hey, whatever else comes up, write it down on this list so we can build it from there of, that happened at my last practice of, and they didn't want that to happen either, but like the first time that a patient died, oh yeah, dang, we got to talk to you about how you do a death certificate, right? So, trying to keep track of those things, I'm sure we can improve on that list that's already pretty thorough. Of things that come up along the way. But I think it's a very, very thorough start.
Thorough start.
Yeah.
And a smooth start, right?
Smooth start. Yeah. Okay. I feel honestly, 3 to 4 weeks, whatever it is that I've been here, I feel like I've been here longer. Awesome. And I feel comfortable, and that's not my personality, like to feel so comfortable and to not feel like an anxious mess. Like, yeah.
We feel like you've been here way longer than 4 weeks, so that's a good thing, I guess, right? So tell me also, how is, obviously you're getting started, right? You do have certain patients that have followed you from your previous job, but you're also getting new patients that you didn't know before. And you are about, almost 70 patients, I want to say, within the, first month. So how's practicing medicine been different?
I love it. I love it so much more. And I think like it's given me back that passion of medicine that, even starts to almost a little bit get trampled even in med school, right? Like you're so busy in residency, you're too busy and right, you're doing too many things and there's just too much. And then, the business starts to fade in or take over really in real practice, private practice especially. But yeah, I love spruce. Like I was telling my husband this last night. I was like, I love chatting with them. And he was looking at it and he was like, how does this work? Like, are these like how do you know when you get a message and all this? And I was just like, I love it. And one of them was my dear patient from, I probably had her for like 5 years or something. And like, we were just talking about a meditation app. And I was like, oh, I have this one. And she was like, I have this one. And I'm like downloading it as we speak. I'm like, I just love it. It's cute. And it's like so much easier and like easier to check in with them. And like, hey, did you do this thing? How do you feel? Like, I just love it. And then to have more time, like I talked to your lady the other day for 50 minutes. And I don't think, the issue that we were trying to deal with, I don't think you could do that. You couldn't do that in the standard 15-minute visit. You couldn't really do it in a 30-minute visit. So, to have the time with people, or at least the ability to bring people back in more often, either in clinic or just over the phone, to have the ability to talk to people over the phone or video, like it's awesome. It just makes practicing medicine easy. Yeah.
It's so amazing the change that happens when you eliminate the barriers between a doctor and a patient, just the communication barriers, basically, right? nobody tells us, how to do it, right? In terms of, hey, 15-minute block, this and
Yeah.
that, right? When we are given the freedom to work with our patients, it really does put the joy back, right,
Yeah.
in medicine. I'm glad you're feeling that same. Okay. So, what could we have done better in this 1 month in terms of, bringing you on board?
I don't know.
I'll take that. What do you see yourself, because we have a 30-day eval, and now then we're going to do a 90-day eval. So in the next 2 months, what do you see happening in terms of you getting more comfortable, obviously,
Yeah.
here, but what else are you wanting to achieve?
Yeah, so I think the obvious is to build my patient panel, obviously, and you got to participate in that, of course.
doubt.
I think kind of going in the clinical order, building the weight management side of it and figuring out how to work that from the whole clinic side of things, other than just my own practice side. And then doing some sort of teaching side is the other big thing I'd like to get figured out with residency programs and
Awesome.
med school. And then along with that, getting a resident or med student to rotate with me, I think would be a lot of fun.
Yeah,
In my personal life, do we want to include that?
absolutely.
I think, and that's part of I think just because I feel so much better, I'm not as stressed out, and I feel like my time is better now. I just want to find other things that the same sort of just give me back joy and just things that go back to where I was, right? The joy of medicine and everything else. So I want to find some time and energy to put back into some volunteer work, things like that.
Awesome. Okay, I am done questioning you, but now it's my turn to give you feedback on how we think you have done.
Are we going to record this part too?
Yes, we're going to record this part too.
Oh no. Does this part go on the internet?
No, I think it's important to listen for people to hear it in case this ends up being public,
Okay.
So listen, I think we are super ecstatic to have you. It's again, we hang out in the same room most of the day, and I look forward to coming to work. I mean, I always did, and I do even more now. So very nice to have you. So we have a tool we call GWC. So this is how we evaluate people here in our organization, right? So do they get it? G. Do they want it? And then do they have the capacity to do it, right? I think you get it, I think you want it, and you have the capacity to do it, basically, right? And I think if those three things are there, anything else is just a challenge to overcome, basically, right? So from that standpoint, I'm very happy, and we're only gonna get better from here on. One thing I do want you to be mindful of is this. It's nice to have spruce and be able to chat with patients.
I knew you were going to say it.
But I want you to be mindful that right now you have 70 patients. When you have 500 patients, you're going to need that time in the evenings and stuff to just be off spruce, right?
Okay.
So set the expectations early for those patients. Avoid resist the urge to respond to them after hours. And I was the worst. Right away responding to people.
Yeah.
And 5 years into this, I've learned it the hard way.
Okay.
So,
I'll work on it.
and obviously you be the judge. If people do need help and we can easily help, definitely help. But otherwise, if things are non-urgent, schedule those messages. Type the message and then schedule it for next morning. Right?
Okay. All right. I can do it.
Yeah. Otherwise, we're good.
Okay.
Thank you.
Thank you.